A second person has now died from the measles as the outbreak grows to nearly 230 cases in Texas and New Mexico alone. Our next guest spoke to HHS Secretary RFK Jr. about the impact of vaccines on the spread.
Measles vaccine protects the community. And there are people who should not be vaccinated in the community because they have autoimmune disease or other immune problems. And if you do get vaccinated, you're protecting those people from a possible spread.
Fox News senior medical analyst Dr. Marc Siegel joins us now. Dr. Siegel, thank you so much. This is obviously a great interview you had with RFK Jr.
Thank you. Thank you very much. And, you know, he emphasized the need for the community to be immunized, and he said that HHS is going to be sending a lot more vaccines down there, which is important because there's the shortages in the pharmacy there. And, you know, you have to, he also emphasized working with the individual and talking to them about it. I mean, and getting a higher compliance rate, because in young children in that area of Texas, it's only about 86%. And that allows measles, which is highly contagious, to spread. Vaccine being our absolute best tool there is a very effective vaccine.
He also talked about the importance of having good science.
We need to understand the relationship between good health and chronic disease. If you are healthy, it's almost impossible for you to be killed by an infectious disease. In modern times, because we have nutrition, because we have access to medicines, what we need is good science on all of these things so that people can make rational choices.
So do we have good science about this?
Well, we have good science about certain things, like the vaccine, but his point about nutrition is profound, I thought, Charlie, because, listen, I asked him, what about the Mennonite community? And he said he's been talking to doctors on the ground there, and he doesn't think that they have good nutrition. And his point that if you have poor nutrition or poor health status, we saw during COVID that people that were obese or in poor health did poorly. And the same would be true for measles. If you got measles and you're in poor health or were malnourished, you would more likely end up in the hospital. That's where that whole vitamin A thing came up, because vitamin A deficiency is likely leads to a worse outcome with measles. So it's all about being in good health and being well nourished. That's his whole theme right now.
Right, right. And of course, bringing quite the revolution to that whole area of trying to make America healthy again, which is probably the right direction to go in. I also want to ask you about new details that have come out in the death of Gene Hackman and his wife. We find out that authorities now believe that Mrs. Hackman may have been dead for over a week before Gene Hackman himself died. And it just kind of strikes me that you know, a lot of people are affected by the issue, the illness of Alzheimer's. Can you make sense of some of this? How does something like that happen?
Here's how I put it together. And remember, I'm going based on what the medical examiner revealed, right, and I didn't see the actual findings. But I think what happened is hantavirus is very rare, but it's found in deer mice in that area, and you can get it from the dust of droppings. And there's about 20 cases a year. And if you get a severe pulmonary problem, which she had, you know, it's very deadly. It's 30 to 50% deadly. You get respiratory failure. You know, she's 56. He, according to the autopsy, had severe Alzheimer's, which means you're not aware of your surroundings, very tragically, and you can't take care of yourself. And he had severe heart disease, so likely he wasn't even aware of what happened. And after she passed, he wasn't able to take care of himself, and he ended up with a heart problem or a heart attack days later, and what maybe wasn't even aware of what happened to her. That's how I put it together. That's the best way to look at the facts right now. More will come out.
Right. And we know for a fact that the hantavirus is not something that is communicable from one human to another. It's only obtainable from the actual deer mice droppings.
That's extremely important that you said that, because people will worry. You're not going to get this from someone else, and that's why it's so isolated number of cases. We don't have a treatment, we don't have a vaccine, but it is extremely rare. It's something that's endemic in rodents, not people. People rarely get it. The dog, I don't think, had it. By the way, it doesn't get dogs sick. The issue with the dog was totally different.
Dr. Marc Siegel, thank you so much for your wisdom.